Okay, so this is botulism. So a few interesting facts about botulism. You can see the little comic in the bottom left side of the screen with the two cans. Botulism is actually used in Botox. So this is where that idea first came from. It's small amounts of botulism is actually used to paralyze the muscles of the face. Botulism is actually the most potent neurotoxin known to man. It's also was first used as um, a biological weapon before World War II. It was injected into hand grenades, so it caused some pretty nasty after explosion effects. Um, so this is botulism. So Clostridium botulinum. So this is a gram-positive stain bacteria, and it's also an obligate anaerobe. This means basically that it has to be in less than the normal 21% oxygen that we all live in every day to be able to live and thrive. When it's in conditions less than that, it actually forms those endospores that we've recently learned about and goes into, I guess, like a hibernation type state. And then when it gets introduced into those low oxygen atmosphere, um, that's when it becomes active. So this is a picture of botulism. So botulism, they're rod shaped, and they can come in single cells, they can come in pairs or chains, and you can kind of see those the flagella coming off of the cells. So these cells are motile. They're able to move around when they're not in their endospore state. Um, so this is a picture of a small child has botulism. Um, so you can tell he has a tube into his mouth. He's intubated. This because botulism causes um, paralysis. So the neurotoxin botulinum is the toxin that the bacteria produces. So like I said before, this is the most potent toxin known to mankind, and its lethal dose in humans is less than 1 microgram. So it really doesn't take very much of an infection to cause death in us. Um, but it can only produce those neurotoxins during sporulation. And again, that has to happen in anaerobic environments. But once that happens, it can cause rapid and severe paralysis. So any type of skeletal muscle is paralyzed from eye movement to moving your fingers to even to breathing. So we'll talk about that a little bit more later. So this is a picture of the mechanism of action of that neurotoxin. So um, it works by inhibiting the release of acetylcholine at the neuromuscular junction. So these are the few of the different types of botulism toxin that there are. So botulism, it can be killed, but it has to be done at temperatures over 100 degrees Celsius. So it cannot be killed by the enzymes in our digestive tract. That's why it's such a potent neurotoxin, because our body has no defense against it. And once it's in our digestive system, it quickly moves to the bloodstream and travels throughout the body. Um, and so here's the mechanism of action.
So there are more than 3 main types of botulism, but these are the most common. I found 5 main types, but the other 2 are usually just subtypes of one of these 3. So there's foodborne botulism, wound botulism, and infant botulism. Reservoir. Where do they live? They're found in the soil, the dust, unclean water, unclean food, honey, and some other things. So really, it's out there, and it's everywhere, which is what makes it so frightening and unpredictable, because it could really be in soil, in your next door neighbor's canned potatoes. But mostly it lives in an active form called spores, because the environment is harsh, so they go into, Stephen called it, kind of a hibernation stage to protect themselves. but once the spores enter the human host or any other environment that's suitable for them, they begin producing the nerve toxins. So this begs the question, why don't we just kill it in the environment then? Well, we can kill it, but the problem is that lots of times people don't, because they don't take the proper precautions, they don't heat it hot enough. In the most recent outbreak, in Lancaster, the woman had used, instead of using a pressure cooker, she used a boiler where you just boil the bottles instead of actually using a pressure cooker, so it didn't get hot enough to kill the botulism. So little mistakes like that. The spores have a hard shell. They're gram-positive, so they have a hard shell. This allows them to survive heat. They can survive being dried, and surprisingly, they can even survive some short amounts of radiation, which is kind of impressive to me, I think. How are they transmitted? It's not contagious, but they can enter open wounds, so farming accidents, any accidents really where there's an open wound, unrefrigerated food or food that's not prepared correctly. There are a few factors that must be present in order for this spore to germinate, and the pH has to be higher than 4.6. The temperature has to be between 38 and 122 degrees, that's Fahrenheit, and there has to be a lack of free oxygen. So, kind of beating a dead horse here, but if the spores aren't killed in canning, they will germinate on the shelf. Signs and symptoms of foodborne and wound botulism. We'll talk about child botulism in just a minute. So the signs are paralysis, drooping eyelids, and vomiting. You can see in the picture the boy who can't keep his eyelids open, and the paralysis that's a result of the neurotoxin. Symptoms are difficulty swallowing and speaking. Obviously, you can't use your muscles, you can't do a lot of those things. Dry mouth, facial weakness on both sides of the face, blurred vision, trouble breathing, nausea, and abdominal cramps. So signs and symptoms of infant botulism. The signs are weak crying, drooling, difficulty sucking or feeding, and floppy movements due to weak muscles or lack of muscle control. The symptoms include constipation, irritability, tiredness, and loss of appetite. So, how do these symptoms come? How do we see them become manifest? Usually it occurs between 12 and 36 hours after you've been contaminated, but it can happen as late as 10 days later, which is kind of frightening to think that 10 days later you could just stop being able to breathe. So first, your muscles become weak, since the paralytic, and depending on how severe the case is, the end result could be that the muscles in your abdomen that make your lungs breathe will not work, in which case you will obviously suffocate. So this is kind of maybe a little bit of a morbid thing to kind of think about and keep in mind, but botulism is a paralytic, it's not a sedative. So what does that really mean as far as symptoms are concerned? So they can't move, but they can feel everything, and they're completely conscious. So I just think it would be so frightening to realize I can't move, I can't breathe, there's nothing I can do about it, I can't call for help, I can't tell anyone what's going on, and it would just be such a terrifying bacteria to have.
All right, moving on into the prevention of botulism. As we'll learn here in a moment, there's really no cure, and there are very limited treatments for people who have come down with this these forms of botulism. So prevention is key when it comes to botulism. Talking about prevention of botulism, Amelia pointed out the 3 types of botulism. First, we're going to go over preventing foodborne botulism. Do not eat food from containers which are bulging or damaged. Do not eat any food that looks or smells rotten or expired. This is pretty basic, I think, with anybody who really knows the hygiene of cooking and preparing food. Use proper hygiene when preparing and eating food. If you can your own food, pressure cook your food at 250 degrees Fahrenheit for at least 30 minutes. Boil the food for 10 minutes before serving. And then eat your cooked food hot. When done, place it in the refrigerator. Do not let the food sit out. This can create a prime environment for botulism. Moving on to infant botulism. To prevent infant botulism, do not give infants younger than 12 months honey, corn syrup, or undercooked foods, as these can be a source of botulism as well. And then in prevention of wound botulism, really the most common thing is that you should never inhale or inject street drugs. And I think that's also pretty basic. That goes along with your personal hygiene. As long as you can stay away from drugs, you can stay away from contracting botulism. And as I pointed out, there is not a vaccine for botulism. So as I stated, be sure to prevent it by performing these methods above. Treatment of botulism. The treatment of botulism can include an antitoxin that can be administered unto you by doctors. It will circulate in the bloodstream and attach itself to any toxin, preventing the toxin from further damaging the nervous system. It will not cure or help with any damage already inflicted. So the toxin gets into the bloodstream and attaches itself to nerve endings in our nervous system. Any damage that's already been done cannot be cured or helped. So really this antitoxin is just to prevent any further damage. So once you've had botulism, you're going to need some help, and breathing assistance can be administered by the help of a mechanical ventilator. No other treatment is available, like I said, so recovery time will be very necessary for the body's mechanical processes, which will have most likely have been impaired. Speech therapy and other forms of physical therapies will be necessary for you to get back to tip-top shape. Now we'll go over some additional information, a statistical review, and maybe some facts about botulism. On an annual average, there are reported 110 cases of botulism in the United States. About 25% are foodborne cases of botulism. The mean age of infected people is 46 years old. Cases have ranged in ages between 3 and 78 years old. Foodborne outbreaks have been reported in 46 of the 50 states, along with Washington, D.C. and Puerto Rico. More than 50% of all foodborne outbreaks of botulism since 1950 have been reported in the 5 western states of California, Washington, Colorado, Oregon, and Alaska. And I think that's a very interesting fact. If you're someone that's really scared about botulism or contracting it, I suppose you should probably stay away from those 5 states. And as our teacher, Sister Chasten, has pointed out earlier in the semester, there was a recent outbreak of botulism in Lancaster, Ohio. The cause of the outbreak was home canned potatoes that were not properly stored and cooked. That was found in a potato salad that was served at a potluck dinner at a religious group meeting. 18 people were ill. 1 person has been reported dead. The age range of the afflicted or the affected persons was 9 to 87 years old. Thank you for learning about botulism with us.